The thorax. The thorax is shaped like an irregular cylinder, featuring a narrow opening at the top, the superior thoracic aperture, and a comparatively larger opening at the bottom, the inferior thoracic aperture. The superior thoracic aperture is open, providing continuity with the neck, while the inferior thoracic aperture is closed off by the diaphragm. Structures in the thorax. The wall surrounding the thoracic cavity is composed of bones, including the 12 thoracic vertebrae, 12 pairs of ribs, and the sternum. Connective tissue, such as the internal fasciae of the thorax and muscle fasciae, and muscles, primarily the intercostal muscles, internal muscles, and the diaphragm. The thoracic cavity is divided into the centrally located, unpaired mediastinum, which contains the mediastinal organs, and the paired pleural cavities. The mediastinum houses the heart, the central organ of the circulatory system, and the thoracic portion of the digestive system, the esophagus. The pleural cavity encases the lungs, the primary organ of respiration. Additionally, various neurovascular structures traverse through or terminate within the thoracic area. As we said earlier, the bony thoracic cage is open at its apex, known as the superior thoracic inlet. This inlet is closely surrounded and protected by muscles and connective tissue, facilitating communication with structures in the neck. The inferior thoracic outlet is nearly entirely sealed off from the abdominal cavity by the diaphragm and its fasciae. The diaphragm typically takes on a high dome shape, exhibiting a pronounced superior convexity that causes a portion of the abdominal cavity to extend above the inferior thoracic outlet. Functions of the thorax. 1. Breathing. The thorax plays an indispensable role in respiration. Beyond enclosing the lungs, it incorporates essential mechanical components such as the diaphragm, thoracic wall, and ribs that enable the efficient movement of air into and out of the lungs. 2. Protection of vital organs. A key function of the thorax is the protection of critical organs. It shields the heart, lungs, and major blood vessels, safeguarding them from external forces. The diaphragm's domed structure extends this protection to some abdominal organs as well. The liver, for example, resides beneath the right dome, while the stomach and spleen lie beneath the left. Additionally, the superior poles of the kidneys rest against the diaphragm, with the right kidney positioned anteriorly to the 12th rib and the left kidney located slightly higher, beneath both the 11th and 12th ribs. 3. Acting as a conduit. The thoracic region also serves as a conduit, facilitating the passage of structures that connect various parts of the body. The mediastinum, positioned centrally within the thorax, acts as a corridor for critical pathways. The esophagus, vagus nerves, and thoracic duct traverse this space as they extend between the abdomen and neck. Phrenic nerves originating in the neck pass through the mediastinum to reach and innervate the diaphragm. Furthermore, other key structures, such as the trachea, thoracic aorta, and superior vena cava, travel within this region. Relationship to other regions. 1. The neck. The superior thoracic aperture provides a direct connection to the root of the neck, offering a pathway for structures that link the thorax to this adjacent region. The upper sections of each pleural cavity extend approximately 2 to 3 centimeters above the first rib and its costal cartilage, projecting into the neck. Nestled between these pleural extensions, vital structures traverse from the neck into the superior mediastinum. Centrally, the trachea lies just anterior to the esophagus, while major blood vessels and nerves pass through the superior thoracic aperture. 2. The upper limb. On either side of the superior thoracic aperture, an axillary inlet serves as a gateway to the upper limbs. These inlets communicate with the root of the neck and are bounded by key anatomical features: the superior margin of the scapula posteriorly, the clavicle anteriorly, the lateral margin of the first rib medially. The apex of each triangular inlet points laterally and is formed by the medial margin of the coracoid process, which extends anteriorly from the scapula. Major blood vessels traversing between the superior thoracic aperture and axillary inlet pass over the first rib. The proximal segments of the brachial plexus also follow this route, linking the neck to the upper limbs. Dre eye, abdomen. The diaphragm acts as a partition between the thoracic and abdominal cavities, enabling selective passage of structures. The inferior vena cava enters the right side of the mediastinum through the diaphragm's central tendon near vertebral level T8. The esophagus transitions from the mediastinum into the abdomen via the muscular portion of the diaphragm, slightly left of the midline at T10. The aorta passes posterior to the diaphragm at the midline at T10 vertebral level T12. Surface anatomy of the female thorax. 1. Anterior view. 1. Clavicle. The collarbone, easily palpable along its full length. 2. Jugular fossa, a small depression at the superior edge of the manubrium sterni. 3. Sternal line, a vertical line defining the midline of the sternum. 4. Nipple areolar complex, comprising the areola, a pigmented region, and the centrally positioned nipple. 5. Mama, referring to the breast tissue overlaying the rib cage. 6. Papilla mammaria, the anatomical term for the nipple. 7. Axillary fossa, the armpit region, seamlessly continuous with the thoracic area. Larynx, positioned at the midline of the neck just above the sternum. Sternocleidomastoid muscle, a distinct neck muscle connecting to the clavicle and sternum. Acromioclavicular joint, the joint uniting the clavicle and scapula. Supraclavicular fossa, a depression located above the clavicle.